part of the digestive system. Cleans the blood, detoxifies foreign substances and chemicals, supports the immune system, breaks down chemicals and toxins, produces the emotions in row 4. Okay? Now, if your liver's out of balance, you might have symptoms like pain between the shoulder blades, discomfort in the right shoulder. You might have headaches. In severe cases, you might be jaundiced. Okay? If somebody comes to you and they're the color of one of those smiley face things, you should have them probably go see a doctor. Okay? You can work on them too, but that can be dangerous. Loss of appetite leading to weight loss, swelling under the right lower ribs also. Okay? If they've got a swollen liver, well, you can work on them, but you might want to also have them go see somebody just to, to make sure they're not going to kick the bucket here shortly. Because you can't live without your what? Liver, right? Pectoralis major, those muscles, and the right rhomboideus muscle especially. The rhomboid is a muscle in the yellow here on the right, and it connects the shoulder blade to the spine. Okay? And the liver I've always kind of thought of as being my favorite organ. If I could have a favorite organ, it's the liver. Okay? How many of you have a favorite organ? Raise your hand. Anyone? What's she laughing about? I don't know. But anyway, the reason why is because when I was in the chiropractic college clinic, I had this guy that always had pain right in between his shoulder blades. And that's a real common sign of liver imbalance, right? But at that time, I didn't know that. His spine was always out of alignment. His spine was like the mark of Zorro, always out of alignment in that area between the shoulder blades. I would adjust him and realign everything, and he'd feel so much better. And a week later, he'd be back, and it would be just like it was before. And so this went on every week. This guy helped me a lot to graduate from clinic. I had to have a certain number of adjustments. This guy was my best patient. But it bothered me because he had to come in every week, and I was never really able to fix him. And I used to wonder, what's wrong with me? Is it me? Is it him? Why can't I fix this guy? His problem, really, now I know, had a liver imbalance, see? So that area, if you have a liver imbalance, it's always going to be out of alignment, really, because you see how the muscles connect up there in the middle? Does that make sense? All right, cool. Talk about the lungs really quick. Purpose of the lungs, of course, main part of the respiratory system, oxygenates the blood, eliminates CO2, produces the emotions in row 3 on the emotion code chart. If your lungs get out of balance, you might have pain between the shoulders or discomfort in the ribs or upper back, or you might have asthma, okay? Now, I had quite a number of patients, and I think probably just about any chiropractor can tell you that they've had patients who've gotten well from asthma simply by adjusting the spine. There's a bone, it's the 3rd thoracic vertebrae. Right in there, okay? Sometimes the 2nd, but usually the 3rd. That bone gets out of alignment. It irritates the nerves that go from the brain to the lungs, and then your lungs aren't receiving good communication from the brain. They start to go haywire, okay? And I could tell you stories about that, but just trust me on that one, okay? Shortness of breath, decreased ability to exercise, a persistent cough, coughing up mucus or blood. Is that a good sign? No. Mucus is not as bad a sign as blood, right? Blood's definitely a worse sign. Discomfort when breathing. Lung muscle connections. Here you can see the deltoid muscle. That's the outer shoulder, okay, the outer shoulder. The front part of the deltoid muscle in here, on the right side anyway, that's gallbladder, okay? So sometimes you can have trouble in the right arm because of gallbladder. In fact, I had a patient that was sent to me one time. She worked at a chiropractic office. There were 3 chiropractors on staff. They'd all worked on her. She had carpal tunnel syndrome in her right hand. Carpal tunnel. Couldn't get it fixed. They couldn't help her. They sent her over to me, and I figured out what the problem, the real underlying problem was her gallbladder, and it was short-circuiting the muscle here in the deltoid. Turned on her gallbladder, and what do you think the underlying cause was? Trapped emotions. Yeah, I think there were a couple. That turned on the gallbladder, and the carpal tunnel magically went away. So you never know what's going to cause what, but there you go. Small intestine, part of the digestive system, absorbs nutrients from food, produces emotions in row 1. Some symptoms might include pain in the low back or the knees, bloating, gas, diarrhea, nausea, skin problems, also sometimes due to lack of nutrients. Because you see, the small intestine is what absorbs the nutrients into the blood. Your colon doesn't do that. The colon absorbs what? Water, right? Small intestine absorbs nutrients. And so if it's not working well, you might start to have deficiencies and you might not be absorbing things well. So here are the muscle connections, the abdominal muscles and the quadriceps, or the muscles in the front of the knee, front of the legs, okay, front of your thighs. Spleen, there it is right there, part of the immune and lymphatic systems. The spleen disposes of old red blood cells. It has important immune functions, holds a reserve of blood, recycles iron, produces the emotions in row 2. Okay? Spleen imbalance might include mid-back discomfort or left shoulder, lowered immunity, pain in the upper left abdomen, which is, of course, where the spleen is, repeated bouts of infection. You might find infection that's actually stuck in the spleen. Could that happen? Infection could be found anywhere in the body, and we haven't gotten there yet, but we will. Excessive bleeding, anemia, dizziness, fatigue, and headaches. The spleen connects up to the lower trapezius muscles, okay? The mid and lower parts. Okay? Can you see those okay? All right. Any questions so far?